I love the intro to the story. If you have skin, yes, we all have skin.
Yes.
You're going to want to listen up to this next story.
It is Skin Cancer Awareness Month, and have you been to a dermatologist lately for a routine check?
Every 3 months. If not, it's time. Melissa Cole learned more at UConn Health.
My wife was looking at my back and she said, you know, some things look suspicious on your back. It's been a long time. It turned out it had been like 20 years since I'd been to my dermatologist. So I scheduled an appointment with her.
And it's a good thing Ken Jones of Canton scheduled that appointment. His back was fine, but turns out there was a suspicious spot on his head, which led to a biopsy and a referral to Dr. Hao Feng at UConn Health.
Mr. Jones had a melanoma in situ, and that's melanoma that's only in the very top layer of the skin. His was caught very early.
This is the initial spot on Ken's head. And even though this melanoma was caught early and the spot was small, Dr. Feng still had to remove and test portions of Ken's skin several different times in order to get all of the unhealthy cells out.
These melanoma cells can just track underneath the skin, so when you looked at it, it looks like completely normal skin that you're removing. But underneath the microscope, you can actually see that these cells were abnormal. So by the time he was done, he probably had a wound that was about this big.
Dr. Feng performed a special surgery to close the wound.
He had the surgery done a week ago, so at 1 week, he's already doing really, really well. As time goes on, the scar gets better, better, and better.
Ken did his best to wear sunscreen and stay out of the sun, but it wasn't enough.
Having had sun exposure here, so the balding aspect, even though Mr. Jones does do a good job of applying sunscreen, being careful, inevitably there's always sun exposure that has occurred over the course of his entire lifetime.
Skin cancer can happen anywhere on the body.
A lot of it is where you've had sun exposure. So sun-exposed areas, head, neck, arms, legs, but there are certain skin cancers like melanoma that tend to happen in places that you don't often see, for example, back of the legs or on your back.
Dr. Feng shows us some examples of melanoma and what to look out for. This one is asymmetrical with irregular borders and colors, all classic melanoma signs.
So sometimes they can be a little inconspicuous. So for example, this one. It doesn't have all the classic features of the one that we just shown. However, that's where your dermatologist, with their training and expertise, can actually look at it using not only their eye, but also using with a dermatoscope to look for features that suggest that it is a melanoma.
Here are examples of basal cell carcinomas.
They can all look kind of different if you look closely, but the classic basal cell has this pearly look with a rolled border. However, some of them can look like patches of eczema. So this is a skin cancer called squamous cell carcinoma. And these type of skin cancers look like a lot of times something that is just growing out. Sometimes they can grow very rapidly with this particular subtype of it, but sometimes they can grow slowly.
So what can you do to protect yourself? Apply sunscreen even on cloudy days. Wear a hat and protective clothing. Stay out of tanning beds. And schedule regular skin checks with your dermatologist.
Are you still getting that vitamin D with sunscreen on?
Yes, absolutely. And studies have shown that using sunscreen does not impact your vitamin D levels. And we really believe that oral supplementation is the best way to get your vitamin D. So there are safe ways to get your vitamin D without exposing yourself to the damages of long-term sun exposure.
Ken plans to take some of this advice.
Never was quite a hat wearer. Now I am. Okay, that's something I promised my dermatologist.
A couple weeks ago, when your wife was just looking at your back, until now, a lot happened.
3 weeks. Yep, 3 weeks had, 3-4 samples taken out of my head, pretty sizable chunk taken out of my head, and then Dr. Feng is an expert at sewing back together, which, you could call plastic surgery in a sense because you want to minimize scarring.
So what advice do you have for people watching this right now?
Totally, no matter what your age, get checked out regularly. Doesn't necessarily even have to be every year, but it shouldn't be every 20 years.
So Ken was really lucky that his wife was checking out his back, right?
Yes, absolutely. And those are sometimes the areas that we never see. And you don't know how many times we see spouses encouraging their partner to get something checked out. And even if that spot that the partner was worried turned out not to be anything else, your dermatologist, who's very skilled at examining your skin, when they look over everything, sometimes they find other things that they didn't even know.
I love Dr. Fang. I think he's awesome.
It's really important that you do this, right? So if you're wondering the people that who are most at risk for developing skin cancer, Dr. Fang says people with fair skin, light eyes, who had multiple sunburns, and people who don't use sunscreen or spend a lot of time outside or on the water.
Yeah.
So you want to visit UConn Health to schedule a skin check. But it's also really people of all skin colors. I know dermatologists will say, don't think just because you can get a good tan
Right,
that you're not at
exactly.
risk.
All right, thanks, Melissa.